Hello, Mr. Foster. My name is Lori Hansen. I'm with the Respiratory Therapy Department, and I am here to discuss your new medications and the devices that you'll be using to take your medications. Is it all right if I take your vitals? Thank you. All right, well, the first medication I'd like to talk to you about is Brovana. It is a long-acting bronchodilator, and the intent of this medication is to reduce the symptoms of your COPD by opening the airway and allowing you to breathe more easily. It is considered a maintenance therapy, so it is not to be used as a rescue inhaler. The doctor has prescribed 15 micrograms per 2 milliliter unit dose via small volume nebulizer. Some of the side effects that you may see with this medication include tremor, increased heart rate. You may also notice a headache or insomnia. These things are common with this medication, but they have been known to subside over time. The small volume nebulizer is used for this medication. We're going to take the reservoir cup and add the baffle. We're then going to take the lid for the medication and put that on there. We'll then add the tea. We'll add the mouthpiece, which is where you'll take your medication from, and then we're also going to add the reservoir tube, which helps reduce loss of medication in this device. We'll attach the air hose to the bottom. Okay, so now that it's put together, let's go ahead and grab the medication. As I said, we're going to be using a unit dose vial of medication, so it's pre-mixed for you. So all you need to do is twist off the top of this and add it into the nebulizer. And once you have that in there, go ahead and screw on the cap to your nebulizer again, and you should be ready to start this therapy. At this point, I want you to be aware that how you breathe is important with all of these different types of medications and the devices used to provide the therapies. So with this one, I want you to breathe normally and slowly. Take in some occasional deep breaths and try to hold for as long as you can, 5 to 10 seconds if possible. This medication typically takes 5 to 10 minutes for the therapy to be complete, and you'll notice that it is complete when this starts to sputter. The medication has been delivered to you. So this medication will show effects as soon as 15 minutes, and it will last for 12 hours. So you should have clear open airways with this medication for 12 hours. The next medication that I want to talk to you about is Spiriva. This medication is also a long-acting bronchodilator, and it is meant to reduce the symptoms of your COPD as well by opening your airways and reducing bronchoconstriction. The doctor has prescribed 18 micrograms per puff, and this will be given 1 time a day. You'll notice the effects of this medication in approximately 30 minutes, and this one will then last. The duration of this one will be 24 hours. This is given by dry powder inhaler, and this Spiriva uses the handy inhaler, and it is Spiriva is specific to this kind of inhaler. So this is the one that you'll use. This medication is delivered by inhalation. And so what you'll do is you'll open up the dust cap, and you'll then also open up the mouthpiece. You'll take the capsule from your foil pack and place it in this hole right here, and you'll be able to see the medication through this window. Go ahead and secure that mouthpiece back down. Listen for the clip to make it secure. And then at this point, you'll go ahead and depress the green button here, and that will puncture the capsule so that you can inhale the medication. At this point, the difference in the type of breathing patterns we need for you to get the most benefit out of this medication is for you to exhale completely and then quickly inhale rapidly and hold for 10 seconds preferably, but if not, as long as you can. Never exhale into this device. The moisture in there can cause it to clump and you wouldn't get your full medication. Typically, it takes 2 inhalations to get the entire dose of this capsule, so you will most likely always have 2 inhalations. And as I said with the other medication, this is also a maintenance medication and not meant for a rescue inhaler. The third medication that the doctor prescribed for you is QVAR. It is a steroid, and it's used to reduce inflammation of the large and small airways, and it is also considered a maintenance drug and not used as a rescue inhaler. The doctor has prescribed 80 micrograms per puff 2 times per day, and this then will last for 12 hours. The medication, when it comes in, will you will get the canister and then the boot, and so you'll place the canister inside the boot, and at that point you'll go ahead and shake the inhaler and warm it with your hands. You will take the cap off, inspect for debris, and you will then depress this and actuate out 1 dose so that you know that it is primed, so you get your full dose. The side effects of this medication, it is a corticosteroid, and so that it can cause oral thrush, and it can also cause you to be hoarse and have a cough. So some of the side effects of this medication, though, can be reduced with by using a reservoir chamber, which is what we're going to do today, and also by rinsing after you use this treatment. So I'm going to go ahead and put the reservoir device on here, and you will hold the mouthpiece to your lips, to your mouth, and secure your lips around the mouthpiece, and then inhale slowly as you actuate this medication, and hold 10 seconds preferably, or as long as possible. And this medication is an 80 microgram dose per puff, so you will only do the 1 puff with this medication. Sometimes it's prescribed in 40 microgram doses, and you would then do 2, but this one you'll just do 1. And once we are finished with that medication, I want you to go ahead and rinse your mouth with water and then spit that water out, and so you do not want to swallow that. Do you have any questions regarding the medications or the devices we've used today? Is there anything else I can get for you? All right, I do need to take your vitals one more time. see how these medications did for you. Wonderful. Okay, here is the remote, and if you need anything else or have any questions, please let me know. Thank you, Mr. Foster.